Thank you, everybody, for joining us today. My name is Derek Fales. I'm the Acting Waiver Services Director with the Office of Aging and Disability Services. I'm pleased to welcome you all here as we talk about the Home and Community Support Services licensing rule that now is in effect. I'll now turn it over to our Acting Waiver Services Director, Erin McDermott, and who will move through today's presentation.
Thanks, Derek. So welcome, everybody. I was happy to see so many people registered to get this information right out of the gate. And as Derek said, the rule became effective on December 3rd. And so we wanted to take some time in this webinar series to go over some of the standards and the process with everyone. And then we'll continue to provide additional materials on the website, examples of review tools, etc. And throughout this presentation, there are a lot of people on the call, and there may be many, many questions, and we hope to answer those across the webinar series. And won't get to everything today, but do please add your questions to the Q&A so that we can keep a record of those and work on developing some FAQs around all of this content. So here's the agenda of what we're going to try to accomplish covering today: the rule structure overview, and then we'll get into licensing and review background, some of the indicators in some areas and examples, a description of what a site visit would look like from the ODES team, and really get in on some of the different standards and what we'd be looking for in documentation reviews as well. So jumping into the rule structure, ODES and DLC worked for a long time together to develop these rules, and historically these programs were licensed under assisted living and residential care facility rule, which didn't always fit our service types and the different programs and services offered. So a lot of work was done to revise some of that rule content to better fit our services. In looking at this chart that's up on the screen right now, the gray areas, the rule, well, just to start, the rule is split into two different parts. The first part is the DLC part, and the second part is the ODES part. Here's a high-level overview of some of those standards, and the gray section relates more to, as you can see here, agency administration, physical plant, health and safety. Those are the items that'll be reviewed by DLC. And most of those requirements apply to all agencies, regardless of what type of services will be delivered. There's some that might be program specific, as you can see here regarding an example on bathroom requirements. There'll be different requirements for residential settings than there would be for day settings that have more people. Moving on to the general program standards that you can see in that lighter blue color. Those are the areas in part 2 that'll primarily be reviewed by ODES, quality assurance and general standards for all agencies, and that would apply more generally, like the gray standards, to all programs. There'll be some sub-standards within those that'll be program specific. And then you can see the dark blue highlighted areas that refer more specifically to different service types, such as case management, day and community, residential. We can move on to the next slide. So it's important to remember that to deliver the HCBS services, programs need to be in compliance with the main care rule as well as the HCBS licensing rule. Here's an example of if we are going to review a group home, which standards apply. So all of the standards in part 1 would apply, and then most of the standards in part 2 would apply to that group home provider. Obviously excluding the day and community and employment services if that agency didn't offer that type of service. So to go into a little bit of the background, and just sort of talk through some of the steps. There'll be more specific information coming out regarding timelines. This is just a high overview description of the process. In order to be an HCBS provider and provide services, agencies will need to be licensed. That process starts with understanding the standards that are applicable in main care rule. If you deliver Section 18 services for Section 18 members, being really aware of all the content in that rule, as well as the licensing rule and which standards apply to you. Provider looking to apply to become a new provider of services would need to have a good understanding of all of that content as well as other applicable policies in OATS rules such as the reportable event rule, behavior management rules, rights. Then the provider would develop policies and practices that describe their services and how they would implement those services in compliance with those standards. Once that's done and somebody feels like they're ready to apply, they would need to apply in the OATS portal, upload those documents that they've developed, complete the application, and then OATS would conduct a review of that content and determine whether the provider is qualified to provide the waiver services. Providers that have previously been licensed don't need to complete that step during this rollout of the licensing process. So once you have OATS approval notice, a provider can then go on to apply with DLC for a license. And this process has changed some. In the past, providers submitted an application to DLC for each individual program that they were licensing, and now it's going to be at the agency level. And you'll include all of your different programs under that one licensing application. So once that application's been submitted to DLC, then DLC and OATS will review the setting. If agencies are going to be moving settings, they would need to reapply and add that new setting and remove the old setting that they're moving from their license. I also wanted to note that some settings will not be reviewed at the setting level, such as shared living, case management, employment, and quarter-hour supports. And those are settings that we won't typically visit during the licensing review process. The schedule for review activities will depend on if a provider is applying for the first time or renewing an application. After that has been completed and a license has been obtained, then the provider must enroll their settings with main care. Next slide. So the different types of licenses that are available, there's a full license. This is similar to providers that have been licensed in the past. We'll find this to be similar. There's a full license, that's a 2-year license. If you're in full compliance with all the standards, then that's the type of license that you'll receive. A provisional license has a term of 3 to 12 months. That's if you're a new provider or in partial compliance with some of the standards. And you have that 3 to 12-month period to come into compliance with those rules. Then there's also a conditional license that's up to 12 months, and those are issued for providers that are in partial compliance with the standards, giving providers time to fix problems and become compliant to hopefully obtain a full license. Next slide. So during the review process, OATS will select a percentage of the provider settings, and within each setting, a percentage of people will be sampled as part of the review. And so there'll be a number of, once that sample's been selected, providers will be notified of the timelines for review, and we'll work to set up site visit observations, conduct interviews, and request documentation from each provider. So to go into some examples of standards and expectations for documentation review. So as I said, you'll receive an email notifying you of timelines for review and a documentation request. So here's a sample. It's very similar to some the HCBS transition to compliance process, as well as other reviews that providers have engaged with us in the past. So we'd be looking at requesting 2 months of service notes for those members selected in the sample, records of select training for sampled staff members, active accreditations if applicable. For day programs, for example, we'd ask for some individual schedules for sampled members for 2 months. Group homes would be a little bit different. I would be asking for a sample of leases, and wellness visit records for sampled members in the past 13 months. And for case management agencies, records of visits with sampled members for the past 13 months. So we would utilize some of that documentation to assess compliance with the standards. And in addition to the set of documents requested, we're also interested in providers uploading other creative ways that they meet standards, such as notices of rights, discovery documents, visitor logs. We understand that each agency has their own style for paperwork and training and interaction with the staff, direct care staff working in the homes, and welcome those additional documents that would meet the standards. All right, so getting into some examples of the different areas and expectations. So on the next series of slides, there'll be some examples, but this is also similar to some of the review tools that we'll be posting eventually that, and so just sort of walking through, there'll be a topic such as person-centered planning. Then we'll list the actual rule standard from the licensing rule. In this example on person-centered planning, I won't read the whole rule, but it's talking about documentation and compliance with the main care standard and what's required in the documentation, as well as the other things that we expect to see reflected, such as the type of service, the activity, the goal which the service relates to, and how staff are engaging with the individual to implement those goals and meet the person's service needs. Another area that we'd be looking at in the documentation would be staffing levels. So the rule standard is minimum staffing must be adequate to meet the individual's needs, implement service plans, and provide a safe setting. So in that sample documentation for that individual, we would expect that service notes show that on all days the members receive the staffing supports as outlined in their person-centered plan, and definition of the service. We also would be looking towards staff schedules that may be able to show ratios and staffing patterns, as well as during our observation if we're doing an on-site review. Another area in the standards is choice. And so the rule standard states that the setting optimizes but does not regiment individual initiative, autonomy, independence in making life choices, including but not limited to daily activities, physical environment, and deciding with whom to interact. So this is not a new standard. This is carried over from the global rule. So people should be pretty familiar with this. And our expectation would be that's in the service notes on at least X percentage of days in the sample. We'd expect that the member is offered and has made choices about their daily activities, and also identifies the options provided to the individual, not just the activity that someone engaged in. So at the bottom here at this program spotlight, you can see a good example of this, where staff worked with individuals to identify meaningful daily activity options together rather than simply selecting from a predetermined list or having a predetermined weekly schedule set up. The choice was actually offered in the moment. Next slide. And I do see questions coming into the Q&A, so we'll go through another example here, but then if any of the other panelists want to pause and address some questions, just speak up and let me know. So here is an example of some daily documentation. As you can see, all of the standard required elements for main care documentation standards are listed out there. Person's name, the service provided was shared living, the date, the beginning time, the end time, the total time of 5 hours, and locations where the service was delivered. So as you can see, the highlighted green areas show different areas where she had choice, she was engaging in activities that were preferred for her, and she was supported across those activities. Next slide. So in this community inclusion example, the rule standard, provider agencies must have a system that ensures adult community inclusion and skill acquisition options are available to individuals every day. And the expectations are that X number of service notes in the sample demonstrate that the individual participated in community opportunities and integrated community opportunities. So just riding in a van or visiting a restaurant necessarily isn't full integration. So there's some examples here, such as participating in a community meeting, attending a religious service in the community, really integrating with different community groups and activities, and having exposure to other people in the community to start to develop relationships with if they don't already have them. In the program spotlight, individuals at one agency are well-established members of their community and have developed strong relationships with many local artists and business owners over time. From frequent interactions, they decide to work together to develop a walking tour, which highlights the people, places, and places that make this town so special. So that's a good kind of call out and highlight of examples of things that we have seen in the past that would meet this standard and we would expect to see in the daily documentation. Clearly written notes showing how the individual was supported across these activities to develop the walking tour. So another example of a daily note and some of the different areas that meet these standards and what we would expect to see. I won't read over all of them. So here's an example of a standard related to employment. Agencies must ensure that all settings they operate in are integrated in and support full access of the individual receiving services to the greater community to the same degree of access as individuals not receiving services, including opportunities to seek employment and work in competitive integrated settings. So we would be assessing service notes that indicate the member as engaged in individualized integrated community opportunities with a focus on informed choice around employment. And so out of that sample, we would be looking for at least one opportunity to learn more about employment in those community engagement activities. In the program spotlight, a good example that we've seen in the past, when an individual walked by Quince and Company in the mill, the individual said they wanted to go in and take a look around. Staff supported her to speak with the owner and ask questions about the business. The individual told the owner that she enjoys knitting and she might like to find a job working in a place that sells knitting supplies. When they returned home, staff supported the individual to use the computer to research knitting shops in the area and to help her send an email to her case manager to tell him about the store and what she learned. Another example from a note. Just one slide back, sorry. Oh, you're skipping over that one because I wasn't reading all the content, but highlighting the green areas, you can see the pattern that we're engaging in here with these examples of notes and some of the key areas highlighted in green that meet these standards. Thank you. Can move on. So this is an example of a standard related to communication. So the agency must accommodate the written and oral communication needs of individuals or applicants, much like we're doing right now during this presentation with the ASL interpreter online with us. You want to make sure that you're communicating in a way that individuals can understand and you're meeting their needs. So service notes would indicate that the individual's communication needs, saying someone was nonverbal and used picture communication system, that system was in place, that the individual had the picture symbols that they needed, and that the staff was working with them to provide supports so that the individual could make choices with those symbols or at whatever prompt level they needed, if they needed some guidance and um, that's being provided, some hand over hand guidance to make selections. If that's what their service needs are and support needs are, we would expect to see that reflected in X number of days in the sample. In the program spotlight, these are all, these slides will all be available and these examples will be available and can be utilized across some of your trainings with staff to highlight what's expected and what would meet the standards. So in these program spotlights with the call out at the bottom of each of these standards, as well as we move to the next slide and see the green highlighted areas. So again, she used her communication board to talk with the library patron about the items that they were checking out. And the DSP supported the member and held her board while she conversed with people throughout the day. In this standard, looking at habilitative services, skill building services, the rule standard is that provider agencies must have documented individual schedules that show how individuals engage in habilitative activities which focus on their goals, needs, and desires. So these schedules are required in the day programs and are only required in residential programs if that's part of an individual's plan or a helpful tool, but won't be required to be in place if an individual doesn't prefer to have their day set up or documented in a set schedule. That said, any of these schedules could be adapted, or a person could choose a different activity. So even though there's a proposed schedule, we would expect that people would be flexible to change schedules based on individual's choice. So in this one, looking across the documentation, we would expect to see that on at least X number of the days in the sample, the member was offered a skill building activity option that aligns with their goals, needs, and interests. And of course, offering multiple options, not just one. So in the program spotlight, when an individual consistently refuses options of habilitative activities offered, staff offered support to help the individual find options they may like. So maybe the choices being offered aren't anything that someone prefers, and the team needs to go and search out some other options to offer. When agency offers an activity multiple times to allow individuals to become more accustomed to the idea over time, they also use social stories to facilitate informed decision making about the options being offered, address any specific concerns individuals may have, and support the individual in eventually choosing to participate in some type of habilitative activity. The agency also considers having conversations with the individual's case manager to discuss options. So upon refusal, this is how one agency worked with an individual to slowly build in more choices that were preferred over time. Next slide. And in this example, again, highlighted green areas, but it's an example of a good note that would meet the standard. In this example, we're dealing with transportation, so all provider agencies must ensure that settings they operate in are integrated in and support full access of the individual receiving services to the greater community to the same degree of access as individuals not receiving HCBS waiver services, including engaging in community life. So we'd be looking at the service notes and expecting that those notes include information about how the member has received information about using local transportation options, if those are available, to access people, activities, and places in the broader community. This may include the provider going with them or providing the training necessary to access transportation or actually providing the transportation themselves. So in the program spotlight, here's an example of a submitted service note that met the standard. For our community travel class today, the individual and two peers chose to go to Walmart, and then for a hike, they learned about the bus route, stops, fares, how to use the pull cord to request stops, and identified several businesses along the route. Back at the center, she added activities to the whiteboard in her calendar. So that's a good example of a note that meets the standards. Again, another example. So quickly went through a lot of standards. You'll have more time with these materials as well as encourage everyone to use the links to look at the new standards that were published on December 3rd. And we'll take a minute here to go through some of the Q&A.
Erin, I can read a few questions for you if that would be helpful.
Yeah, that'd be great. Thanks, Alicia.
Okay, and just because it's 12:35, everyone, I think it's likely that some of the open questions in the chat are not addressed in this webinar. As ODES moves through this series, questions will be tracked session to session, and an FAQ will be posted toward the end of the month. I know some people have said it would be helpful to be able to see the questions that other people on the call have submitted. So we're hoping that the FAQ can serve some of that. And so I think I'll just go backwards, Erin, in order of most recently submitted, and we'll hit a few and then move on.
Sounds good.
Okay. So Susan Bradley Dreyer asks, for employment, must daily progress notes be written on paper?
And Lisa, I'll ask you to unmute to address this question. If you're not available, that's okay.
I'm here.
All right. Great.
So our expectation for documentation of any service is the same. That is in main care rule. So we would expect if a service is provided, such as work supports, employment specialist, or career planning, that there is a note that aligns. Notes can be in both written format, paper format, and also in electronic format. They will be submitted by the provider as evidence. So even a paper note will be uploaded to us. So again, documentation is required for all services, for each service as it's provided. I also will add into the Q&A the most recent documentation training if you haven't seen that.
Thanks, Lisa.
There were a few questions that touched on documentation standards, so I'll skip by some of those. Like Lisa said, the standards apply more broadly than just one service type or situation. And then Jenny Peterson has asked, when can we start adding new settings to our new license?
More information and guidance will be coming out about timelines for currently unlicensed providers and providers that went through the emergency license process and need to now update with additional settings. So you'll get additional guidance from DLC on those timelines.
And then Sadil Davis asks, will documents in Evergreen need to be downloaded by the provider, or will reviewers have access to Evergreen?
Reviewers will have access to Evergreen, but I will highlight that the expectation is at programs where people are implementing services, we will be asking to see a copy of the service implementation plan. And we do expect that providers would have a copy of the person-centered plan as well. But we will be able to access Evergreen to review documentation in Evergreen.
Okay, and I know many members of the ODES team are on. Just a last call for any questions that they saw come through that are especially relevant that they'd like to answer live before moving to the next section of the presentation.
I didn't see any myself, Alicia. Some of the questions definitely we can provide additional guidance through FAQ documents. Also, I do see some of the questions are really related to home community-based services and the global rule and current expectations, and there is existing guidance, and ODES is always here to provide technical assistance to ensure a provider, if they're billing and seeking Medicaid funds, are following the correct standards while supporting the individuals to ensure choice and support. So we'll continue to provide that technical assistance as well. And please reach out to ODES for any technical assistance regarding standards for residential or community support so that we can better support you. And I think we can move on to the next session.
Great. And at the end of the webinar, we'll list that HCBS email address where you can send those types of specific questions. And I did see something, but yes, a copy of this presentation will be posted on our website as well as a recording. So moving on to get into what a site visit will look like in that process. So one component of ODES review is a site visit. Every site may not receive a site visit, but any site could. The site visit would include observation, interaction with members receiving services, interview questions for those individuals, an opportunity for individuals to talk with us and tell us if they have any concerns or how much they really enjoy the program. We would also conduct interviews with staff providing services during those site visits. And not every member or staff member would necessarily be interviewed during those visits. One of our goals is to be to minimize disruption to program activities while we're on site, and work with the teams to identify good and bad times to conduct interviews or be in certain areas of program. We want to do what we need to do and then leave people to their own privacy and ongoing activities. And we know sometimes these visits can be disruptive. So we want to work with your teams to make it as less disruptive as possible. Some of the standards that would be assessed while we were on site are dignity, respect, and privacy. The standard is that agencies must assure that individuals are treated with consideration, respect, and full recognition of their dignity and individuality. So one way we might see this is personal care tasks are completed in a way that preserves dignity. If personal care is visible, if we happen to observe it during our visit, we would want to see that someone is taken to a private area with the door closed, and the member covered as much as possible. If something were to happen in the moment in a room with others, then covering someone, for example, with a blanket, and then we would leave the room, but taking those steps to ensure dignity and privacy. We would also expect to see staff being as gentle as possible, maintaining body privacy and avoiding rushing or exposing the person unnecessarily. No care tasks should be conducted in public or shared areas. Next slide. So some more clear examples of this. Say we were on site and somebody was in a restroom and the door couldn't close because they used a wheelchair to get into the restroom. The door, as you can see in this illustration, opens in. The individual is in a seat on top of the toilet and isn't able to close the door. That's obviously a long-standing issue where this person, every time they go to the bathroom, doesn't have privacy. So that is an area that would be deemed non-compliant and need to be addressed. Another example is personal care needs are being observed being unaddressed by staff. And finally, obviously, if someone's loudly talking about someone's personal care needs, they need it in public area loudly, that would not be respecting somebody's dignity and would not meet compliance for that standard. So another area under dignity, respect, and privacy is agencies must create an environment that ensures each individual's privacy, respect, and dignity is upheld, maintaining a policy that promotes these protections, and must maintain documentation that all staff have been trained on the policy. So we'd be looking at this, and if the stated policy said all of those things, but then we went on site and saw the example I used previously with the bathroom door, then practice isn't in alignment with policy, and we need to see some correction around that area. Another example is, does the physical space promote dignity for the people receiving services? It's clean and neat, and age-appropriate decor is observed in alignment with the individual's preferences. No over-reliance on cartoons, juvenile themes, unless that's the preferred decoration by the individual in their bedrooms and home environment. But we wouldn't expect to see that widely decorated in a day program, for example. Ways of promoting dignity include maintaining that neat space and providing adult-focused materials whenever possible. There are numerous art supplies that I engage with that are not child Crayola boxes all the time, different colored pencils. And if Crayola is a preferred crayon for someone, fine, but trying as much as possible to utilize different crafting supplies that are more age appropriate. In the area of person-centered planning, the rule standard stating that the agency must train direct support professionals on person-centered practices, including person-specific training on the services being provided. So that's not just the standard CDS person-centered service plan and practice training. It's the specific needs of that individual would be provided in training to all the staff. So we'd be looking at, does a SIP updated within the past year exist for every member included in the sample, and is it accessible by staff in the program? So we'd be looking for those, as I stated before, and we'd be looking to see that the staff are trained on those and able to implement them and speak to them. So one way to demonstrate compliance with the standard is making sure that those documents are on site, as someone asked about in the Q&A. Those are the evergreen documents we would expect to see on site. In the area of communication, the agency must accommodate the written and oral communication needs of individuals. So as I went over before in the documentation request, we'd want to see that active, in process, in practice, on site. I'm going to go kind of quickly just so we'll make sure we get through everything. And we'd be looking for those tools that help assist people to communicate as appropriate to their plans. Behavior management restrictions. So that's another area that we'd be looking at on-site reviews, that there aren't any restrictions, barriers, security devices in place that haven't been vetted and approved by the teams and documented in the person-centered plan and in their HCBS modification or a positive support plan, PMP. And something else, I'll just take a quick note. It's fine to stay on this example slide of restrictions that we'd be looking for, but also just want to highlight that just writing up a plan outside of the PCP process that doesn't have signatures and approvals of guardians, individuals, isn't sufficient. And I've seen that with some programs. So it needs to go through the process of approvals and be a part of the person-centered plan. So these are examples of some door alarms, a lock on the refrigerator. So these we would flag and would want to make sure that there's approved documentation in place to support the use of these types of devices. Otherwise, we'd ask for them to be removed, or that you seek out the proper approvals if they're really needed for health and safety reasons. So here's some examples of potential interview questions that we'd engage with staff on. On the left, you can see potential staff interview questions, and on the right, some potential interview questions for individuals receiving services. I won't read through them all. You'll get a copy of these slides and can read over them. So additional questions. I'm going to leave some time at the end here and give people an opportunity to write more into the Q&A so that we can start working on those for FAQs as well.
Erin Qualls says, I have submitted an application, but how does a provider start as a new Section 21 provider?
So you've gone through and developed your materials and submitted an application. And so once that application, the paper application and the uploaded materials is reviewed, then you would receive an email saying that the application has been approved, and an interview would then be scheduled. And there's an interview panel that meets with providers that have completed and passed the paperwork piece of the review. And then responses to those interview questions will be reviewed and scored by the panel to determine whether that applicant was a qualified provider or not. And if the panel recommends approval, then the provider would receive that ODES approval letter, which would mean then they can move on to the next step to apply for licensure.
And Richard Mondevue has asked, do you have a form that we could use for risk assessment for homes?
We don't have a standard home risk assessment document that I'm aware of, but that's something that we can take into consideration as we're working with DLC on additional tools and guidance to support this process.
And then there are two questions that both relate to the restrictive device example that we just went over. So I'll read those together. Clint Albee asks, the picture with the door, was that an alarm system or a chime? Some places may have a chime that lets someone know they're there. And then Chris Defoe says, a lot of shared living homes have smart cameras, doorbell cameras, or Alexa type devices to allow folks to talk to members throughout the house as a household security measure. Do these need a safety plan?
I would encourage people to, so just going with the first one, the picture with the door. So the picture on the left, maybe you can click back to that.
Yep.
The one on the left is a lock, and it looks like it's on a refrigerator or a freezer. And the one on the right is, it could be a part of an alarm system. It looks like a chime to me. Regardless, the chime is a restriction because it alerts people to coming and going, and would need to have some of those, would need to have appropriate approvals and documentation in place in one of those plans. The other question regarding cameras, I would encourage you to reach out to the HCBS mailbox. We can talk through that more specifically.
And I'll just move forward to that email inbox so it's on the screen.
Great, thank you.
And then there have been a few questions and comments that have come in that touch on the difficulty of providers getting access to and having visibility in the Evergreen system to various planning documents. I know that just that's come up a few times in the chat, so I'm wondering if you have anything to say to address that.
I would encourage people to
jump in.
Go ahead, Derek.
Certainly, we are exploring different ways to ensure that service providers, so if you are tagged into the plan as being authorized to deliver a service, we do want to make sure that you have access to those planning documents. Otherwise, you wouldn't be able to do the work. I did say in the chat that community case management agencies are required now. They're actually required by federal and a state rule to provide a person-centered plan. We would find a community case management agency responsible to ensuring all people who are identified as Medicaid providers or under the waiver program or PNMI to deliver services, that they do need to have a copy of that PCP and the SIP in order to carry out their responsibilities that will hold them to. Also, there are some comments around the application, so please reach out to the waiverprovider.odes@maine.gov, and we get happy to answer those questions. And with the remaining 2 minutes, I just want to thank everybody for attending. I know that we definitely did not have enough time to address all the questions that we could address today. For those questions that are things that we want to take back, we will be taking those back, developing frequently asked question documentation. They'll be helpful for our technical assistance, and they'll also we'll be working closely with our partners at Division of Licensing and Certification to make sure that we're equally responsive to all the providers. Our goal in this licensing rule is to ensure that every provider has the support and the technical guidance from ODES and Division of Licensing and Certification to be successful. At the end of the day, success means our people that we're supporting, individuals, have access to high quality services and supports. Families and individuals know what's expected of providers in delivering those services, and outcomes and goals can be met. So thank you very much for attending today, and we're happy to continue these conversations on an ongoing basis throughout the foreseeable future to support everyone to be successful through this new process for many who have not had to be licensed before. So thank you very much, and I hope to see many of you again at one of our additional listening sessions.
I also threw in the link to the DLC website in case there's people on the call that did not get to see the documents. They're in the bottom right corner now, posted on the DLC website. So that full licensing rule is there, as well as answers to comments that were submitted during public comment. Thank you, everyone.